So here you are watching drug-induced sleep endoscopy based monitoring in a 58-year-old male with history of snoring, choking. He is a CPAP user. His body mass index is 28, so he is a little overweight, and his AHI is 24, half of which are apneas and half of which are hypopnea. Now you can see here he has got a deviated septum on the left. You can see the spur on the left, which is pretty significant. There is a little high deviation on the right. So and turbinate hypertrophy obviously. I'll go in from the right side because the space is more on the right in the lower part. There are no adenoids. The salpingopharyngeal folds are also grade 0 by Agrawal's classification. I will not put them a lot of marks. What I see here in the lower part, the collapse is more lateral in the lower part. You can see it's a funnel shaped collapse. The upper part is not collapsing. Lower part is collapsing and it's more lateral. Though now you can see the palate is very long. So once we correct the lateral, if you only pull it laterally, then the palate will start collapsing anteroposteriorly because the palate length is quite a bit. The tonsils are also pretty large clinically, and therefore this whole collapse is seemingly more lateral, but you cannot uh, do only the lateral collapse surgery because you see how long the soft palate is. That's the uvula, which is pretty long. So right now the predominant pattern is lateral. The tongue base and the epiglottis are not contributing to the collapse. That's the best part. That's what we even saw on the cone beam CT, that the tongue was not large and the palate was pretty long. So the length we assessed was of the and AP collapse, the midline of the palate. And here we are seeing that this is the tonsil, a little endophytic tonsil he had, but they were seemingly little large, and that's what we are seeing here. So it's a good candidate for suspension bridge pharyngoplasty, both for AP as well as lateral, along with septoplasty and turbinoplasty. Thank you for watching. Your sinuses are clear, allergy is not a problem. You should really do well. BMI is not very high, so you should do well with the surgery. Thank you for watching.